name is Amanda Nelson. I'm an associate professor of dermatology at Penn State College of Medicine in Hershey, Pennsylvania. And we were fortunate enough to present some of our lab work today. We are focused on understanding the mechanisms of isotretinoin with the goal of identifying the next isotretinoin as a future therapeutic for acne. And through a bunch of computational approaches, we think we've identified some top candidates for what the next isotretinoin would be, and hopefully we'll move those into clinical trials soon. So isotretinoin's been on the market for 40 some years, and it's the most effective acne therapy that we have, but it is associated with some side effects, including teratogenicity, as well as some side effects that patients don't really like, so dry skin, sun sensitivity, and chapped lips, which patients really complain about. And so if we can identify the next therapy that works as well as isotretinoin and maybe mitigate some of those side effects, hopefully they'll be more compliant with their medication and more options for patients and clinicians. Our top candidate right now suggests that isotretinoin is acting as a mTOR inhibitor, and so given that topical sirolimus is out on the market for other indications in inflammatory skin diseases, we think that that drug might be the most logical next step. So we're moving forward with a very pilot clinical trial at Penn State in the near future, and hopefully we'll have those data in the next couple of years. This was a really long-term study. So we actually started this study way back in 2015 with foundational support as well as some support from the AARS. And so, fast forward 10 years, we finally got here. Some of the challenges were actual patient recruitment, so getting the sample numbers that we needed in order to do the studies. Obviously, COVID put a big bottleneck in the middle of our study, as well as waiting for the technologies to catch up to allow us to do what we really, really wanted to do with these patient samples. They just weren't there in 2015 when we envisioned the study, but they're there now. And so we've been able to move the study forward. Through our work, we've been able to actually understand how isotretinoin is working in the skin of acne patients. And so we've identified a couple of top candidates, but we've identified over 300 different compounds which have very similar actions to isotretinoin. As we start to mine this data set, this has very broad implications for the acne world. Any one of these candidates potentially could move forward and be the next isotretinoin. And so through this research, hopefully we'll identify novel pathways that inform us about acne pathogenesis itself, but also the next round of acne therapeutics.